So, good morning, sir. I am Gail Christine Lago, your student nurse for today. So now I'll be assessing your breast and axilla. And before we start, let me ask you some questions. So, sir, have any of your family experienced breast cancer? Have you had discharge from the nipples? Have you experienced pain or tenderness in the breast? So before we start our procedure, I must perform hand hygiene. Then inspect your breast. And inspect the color of the breast. So now let's emphasize some retraction. So sir, can you please sit down? So sir, can you please raise your hand? Okay. Then can you push your hand together? Push your hand. Okay, so can you put down your hand on your hips? So next, I inspect your areola and pupil. So now I'll palpate your axillary, subclavicular, and your supraclavicular lymph nodes. So sir, can you please raise your arm? So in supine position, let's palpate the breast of our patient using the hand of the clock technique. So now let's perform the concentric circle pattern of the breast palpation. And lastly, let's perform the vertical strips pattern of breast palpation. next, I'll palpate your arugula and the nipple for masses. So sir, here is the result of your breast and axilla. So the inspection of your breast is the breasts are even with the chest wall and may be similar in shape to female breast. And the inspection of skin of your breast is skin uniform in color and the skin is smooth and intact. And the result for the pushing of hand together, there's an accentuated traction of breast tissue. And the inspection of your arugula and the nipples is round and oval, and the literally the same, and the color is light pink to dark brown, while your nipple is round, everted, and equal in size, similar in color, smooth and soft. So for the result of your axillary, subclavicular, and supraclavicular, there's no tenderness, masses, and noodles. So for the result of palpating your breast for masses is there's no tenderness, masses, and nipple discharge. And the result of palpating your arugula and the nipple for masses is the nipple for masses is there's no tenderness, masses, noodles, and nipple discharge. So that's it for today, sir. Thank you for your cooperation.